The COVID-19 might stay with human beings for a long time, and our lives will not be the same again.
Make no mistake, we have a long way to go. This virus will be with us for a long time. There is no question that stay-at-home orders and other physical distancing measures have successfully suppressed transmission in many countries. But this virus remains extremely dangerous.
But when this pandemic had just started to drip, the World Health Organization took a few steps to get the research started, and in due course, they have tried to accelerate the process. So we headed back to a document released by Global Research Collaboration for Infectious Disease and scrolled over to find 8 immediate research actions they agreed upon. Let's see what they are and how they will help us. The first point includes rapid tests, which ensure testing and treating at the same visit so as to improve the patient outcomes and reduce the transmission of the infection. The patient data is of course noted, which might be useful in the near future.
Taking into account the rapid spread and absence of specific treatment for COVID-19, premier institutes of technology in India have been fast-tracking research and product development to manage this pandemic. IITs are now occupied with more than 200 active research activities to handle COVID-19. Of these, 25 ventures depend on data science and artificial intelligence. A lot of projects have been proposed on dynamical systems modeling and differential equations. However, the tech industry is dealing effectively with the current crisis without much of the chaos under its hood. They are coming up with notable innovations and innovative collaborations to introduce tools, measures, solutions against COVID-19.
An adjunctive therapy, as the third point mentions, is a parallel treatment to that of the primary treatment. Now, an adjunctive therapy not necessarily cures the disease, but helps to contain its symptoms. This gives patients time to recover and slow down the infection process. A great example would be chloroquine diphosphate, a research on 440 patients though didn't have conclusive results. It is a safe drug, which has been used for more than 70 years to treat malaria. However, it here claims that a higher dosage of chloroquine diphosphate for 10 days was associated with more toxic effects and lethality. Therefore, we cannot stick to one adjunctive therapy and work on multiple possible ones parallelly until there is an assured primary treatment for COVID-19.
Up to 10% of the reported cases in China and up to 9% of all cases in Italy have been among healthcare workers. It is probable that nosocomial outbreaks are important amplifiers of the local outbreaks, which affects the vulnerable populations. IPC practices are therefore critical importance in protecting the functioning of healthcare services. It provides an overview of measures to prevent and limit COVID-19 transmissions. On 24th April 2020, UNICEF is stepping up donations of health and hygiene items for families and health workers in 12 Latin American and Caribbean countries affected by the COVID-19 pandemic. According to Bernd Assen, the UNICEF Regional Director, UNICEF has taken steps in keeping health workers safe and making every effort to help them.
Since the beginning of the COVID-19 outbreak, UNICEF's Global Supply Hub in Copenhagen has continued to be fully operational. Our priority is to ensure the life-saving supplies continue to reach the most vulnerable children, particularly those affected by emergencies.
So stay tuned for the next part and don't forget to like, share and subscribe.